Hey guys, I'm back with another video. I just want to give an update of kind of talk about how the coronavirus is affecting healthcare workers and what it's like working in a hospital during this time. I just got to work, and as you know, or if you may not know, I work in the ICU. So obviously if patients are super sick in their lungs, get to that point or their body just starts to shut down, they come to the ICU. Our ICU is broken up into different units. So we took one of our units and we specifically made it a COVID-19 cohort. So if there are symptoms or a patient is positive, they will be in that unit. So that unit is specifically closed off in multiple areas. There are signs everywhere saying do not enter, you can only get in one way in that unit. And the way we've done things, I think, are very, very interesting. I can't speak for other hospitals, I don't know, but I feel like the way we're treating it and going about it is amazing. So just to get a little overview, if you can imagine, so one, our COVID unit is closed off. So if you're working in that unit, you must wear an N95 mask, you wear disposable scrubs, and you wear the booties over your shoes, which is cool. So you don't come in, with your normal scrubs, you don't take them home with you. So you come in, you change, and then you dispose of them, get back into your normal scrubs when your shift is over. You are also not allowed to leave that unit until your shift is over. So if you have to go down and get food or anything or medication, we have our charge nurses who do everything for you. So when you go downstairs and get food, they will bring it up for you. You're not allowed to leave until your shift's over. Just to protect others around you and limit the exposure. We're also doing stuff with our IV pumps. So we keep all of our IV pumps outside of the room. Basically what we're trying to do is limit the amount of times you have to go into that room. So our IV pumps, we have connection tubing, and we just extend it all the way until we can have the IV pumps out of the room. So that way if we need to change medication, add more volume or anything, we can just do it from outside of the room rather than going in and out every single time. I think we're doing that with our ventilators as well, which is, it's all very interesting. It's very different. When you peek through the windows, if you're not in there, the whole setup looks crazy. But it's also very important. We're just limiting the exposure amount. Also, all staff in the hospital is required to wear masks. So just like surgical masks, nothing special. And then if you have a COVID patient potential or any type of other patient with, on airborne precautions, obviously you wear an N95 mask. Just a certain type of mask like that, 1511 Moldex, 1870 plus mask. You wear that underneath, and then you also have to wear your surgical mask on top, just for extra protection as well. I get asked a lot of questions, how is it like working in the hospital? Are you scared or nervous? Honestly, I'm not scared or nervous working in the hospital. I've been telling my family and friends that I feel safer working in the hospital just because of the fact that we're testing patients, so we kind of have more of an idea of who may have it, who may not have it, and we have the necessary supplies, we take the necessary precautions. I feel like there's a higher risk of being out in public, like if you're going to the store, just touching stuff. And those people, there's a lot more people you encounter. We don't know their health status. Are they positive? Are they not positive? So I feel like we're in a more controlled environment, which makes me feel more comfortable and safe. The hospital itself, the coronavirus has affected healthcare. We were thinking, oh my gosh, lots of people are going to be sick. We're going to need tons of staff. And yes, this is the case in New York and other heavily populated areas with the virus. But speaking for Arizona, our hospitals actually have slowed down. My hospital has. I have a friend who works at a different hospital. Hers has. Our ER is slower. And I think this is due to the fact that, one, we're not doing elective surgeries, which is huge. People obviously are more afraid to come to the hospital, and I feel like maybe we're limiting who we admit as well. So that actually was a surprise. In my unit and other units, like before this all happened, we were constantly sending out messages, hey, we need help, come in. Now it's the complete opposite. They're actually asking lots of us to be put on standby just because it's been slower. Sometimes we have MTO, which stands for mandatory time off. So that means like your shift is kind of like canceled just because they don't need you, which is like a huge shock to us. And it's kind of hit or miss now. So like some nights they might send out a message saying, hey, we need help. Other nights they might say, hey, stay at home. It's just been more of the hey, stay at home more than need help, which is just crazy. I personally have not been told to stay home, but on my shifts, I've been getting my scheduled shifts, thankfully, but we're doing it put on a list. So, if one of my coworkers got put on MTO or standby, then the next one on the list is up for that. So if this continues, my time is coming. I hope it does not. I hope that we do start to pick up shifts. Not saying that I hope that people are getting more sick, but I just want things to kind of keep on moving. Just some other little tidbits. Every employee that walks through the door, so now we only have people walk through the main entrance. We're all scanned with like a thermal infrared process. So we kind of like stand on this X. They have these radars that like just scan our whole body, and they're checking for a temperature. If you have a temperature, you have to go home, report to your manager. If not, then you can proceed to work. They also ask you if you have any symptoms, coughing, sneezing, vomiting, diarrhea, any of that type of stuff that is related to COVID-19. If you have any of those, you cannot work. Talk to your manager, and if not, then yeah, you just proceed. We don't do self-serve anymore in the cafeteria, so things like cereal, the pizza bar, salad bar, stuff like that would people, touch and put on their plates themselves, that is no longer an option either. Family members are also no longer allowed to come into the hospital, so we have like a system set up here, so we only speak to one family member. Each patient has a password set up, and we only deal with that family member. We set up a time with them of what times they would like us to call them to give them an update status on their loved one. If their loved one is in critical condition, not doing too well, we will allow them to come to the hospital, to be with them during that time. We will obviously give them a mask. We will also give our patients masks, but only if they request them. They're only allowed one mask for the entire visit, obviously due to the low supplies going around. But there's just little insightful information of what I'm personally dealing with in my workplace. I also just wanted to mention before I wrap this up, I see a lot of people wearing masks out in the environment, out in public, which is awesome. But just remember to always wash your hands as well. If you're not washing your hands and you're just wearing masks, you're not really helping too much. It can be on surfaces, this virus. So stay hydrated, stay safe, self-quarantine, also exercise. Remember social distancing. I think, we have the peak coming up also, which is kind of scary because this virus is just kind of like just taking over. It's growing very, very rapidly. So everybody make sure to do your part. Again, just stay safe, and I will see you guys next time.